Living Through a Pandemic, How the Lowcountry Moves Forward.
So what we need to do is take every step at our disposal to see to it that our children get back in their classrooms.
Not only has this virus not gone away, it is growing precipitously in the Lowcountry.
And if we think about an average of 3 contacts per case, that leaves us with having to interview approximately 4,000 people every single day.
And you're looking at the spike in numbers, it keeps on going up and up and up. We're all saying that we've got to do more, or we're going to have this area shut down. So we decided that we were all going to take steps.
Good evening, everyone, and thank you for staying with us for our special report, Living Through a Pandemic, How the Lowcountry Moves Forward.
We have had a lot of good information, and we have a lot more to come as we are just weeks before school is scheduled to start. Still lots of questions for parents and teachers. What will school look like, and will families and teachers be kept safe? News 2's Sophia Desasor took those questions and more to the state capitol. A one-on-one conversation with State Superintendent Molly Spearman.
President Trump, Education Head Betsy DeVos, and most recently Governor Henry McMaster all pushing to return to the classroom. This as Lowcountry counties continue to fall short of state standards recommended before returning to in-person classes. I sat down with State Superintendent Molly Spearman, who says parents and students need options and the choice should be theirs.
Well, there's no doubt that children thrive best if they are face-to-face with a teacher in a very safe and comfortable environment. So that is my goal. I also have as a standard and realize that with the pandemic, this option should be left up to parents, and they do need options. So while face-to-face is very important and we want to offer a face-to-face experience for every family, it's also important that we offer a virtual experience.
And we've spoken a lot about that virtual option, which a lot of families already went through at the end of this past school year. We do know that some students have struggled with that option, and we do know that there are some 10,000 students who were kind of lost in that. What is the plan to re-engage with those students, especially if this program is going to continue on into the next year?
I think on March 16th, we went into emergency instruction, and the virtual program that you saw we did the best we could. Some districts were better prepared than others, but no one envisioned or was prepared for weeks and weeks and weeks of virtual instruction. So the virtual instruction that you will see starting in August or September is going to be much higher quality, much higher expectations from students. So it will be different. It will be better. And students will have a responsibility to be very engaged on their attendance, on the work that they turn in. So while again I don't want to say anything against what school districts did back in March, because it was overnight transformation and I applaud them for what they were able to accomplish, but this virtual that we'll be beginning will be much higher expectation.
Do you wish the governor was taking a harder stance in putting regulations in place now so that we could be in a better place later?
Each citizen of South Carolina plays a part in whether or not how normal we will be able to go back to school. So it is a personal responsibility. That's hard to legislate. That's hard to say and order. But folks need to put on masks, and especially our teenagers and college-age students need to get out and really be a part of this and help protect us so that we can go back to school, we can have normal activities, high school football games, college games, all the things that we look so forward to in the fall. But it's all of us working together to make that happen.
Is there anything you wish our leaders were doing differently during this time?
I was concerned when I heard folks in Washington started talking about how schools should be operated in Charleston, South Carolina, or Dorchester, or Summerville. I don't believe that directive needs to come from Washington, D.C., and really not even from Columbia. That needs to be decided in the local community where it's best, where folks know the spread, they know the needs of the community, and that is a local decision. I still believe strongly that all parents should have an option. They should not be forced to say that their children have to go back to school 5 days a week. We have to offer them a virtual option.
Districts need to release their plans 20 days before the first day of school after approval by the Department of Education on Wednesday. The governor said he directed Spearman to deny any plan that does not include an in-person option and that he wants those plans submitted by tomorrow. Reporting in studio, Sophia Desasor, Count on 2.
Sophia, thank you. Government leaders are also working hard to help people adjust to the new normal and find the best ways to keep our economy open while trying to lower transmission rates. We continue our discussion right now with the mayor of the city of Charleston, John Tecklenburg, about what city government is doing right now. Mayor, thank you so much for being with us and for staying with us to help us better understand what you're doing in the city of Charleston to keep people safe. One thing that happened today was a day of prayer in the city of Charleston. You were asking people to be in prayer and to at least remember more than 1,000 lives that have been lost as a result of this pandemic in South Carolina.
That's right, Carolyn, and it's so sad, the loss of life. And for months now, we've been watching these numbers build on the screen. But when you think about over 1,000 deaths now in our home state of South Carolina, and Charleston County now leading the state in the number of active cases of coronavirus, it's sad. And we do ask God for His grace and His guidance going forward, His blessings to all those healthcare workers who are caring for those who are sick, and a path forward, how to move forward. And so there is a new normal now that we have to realize. Until there's a real cure or a vaccine, we've got to protect ourselves from one another and care for one another. And you do that by wearing a mask and watching your distance and washing your hands, good hygiene. Everybody's been preaching it. We need everybody to do it.
You've described those as the 3 W's.
That's right.
Wearing a mask, washing your hands, and watching your distance. That distance, of course, being 6 feet. Mayor, you touch on the fact that more than 1,000 deaths in South Carolina. Disproportionately, those who have died have been people of color, right, with the Low Country being 30% African American, but 50% of those who've died. What are you doing to affect those underserved and those communities?
So this virus, when it attacks your body, it looks for the weakest point. And so if you have some underlying health condition, it'll go for it. And so this indicates the health disparities that exist between whites and African Americans in terms of diabetes and all these other health issues. And so proportionately, this is the net result.
What are you doing to try to help those communities? I know that one thing you said was try to make sure that those testing sites are in locations where people can get to them.
So for example, this coming Monday, the city of Charleston is sponsoring a testing at our Julian Devine Center over on the east side, and people can sign up. But I also would advise folks to look at the DHEC website because they list all of the testing sites. We've been trying to go to underserved communities, working with Medical University, the Shifa Clinic here in Mount Pleasant, and others, in order to provide testing just so people will know that they need treatment and they need care. Sometimes you'll be carrying this virus and you won't even know it.
Right. Lots of people are asymptomatic. There is also a clinic that's going to happen July 25th at my beloved Burke High School in downtown Charleston. So hopefully people will be able to get to that. Mayor, you know, you've talked about the 3 W's and that it's very important that people wash their hands, watch their distance, as well as wear a mask. That's really difficult to do in a community where people enjoy eating out. So how are you supporting restaurants? I know one thing you've done is you have, in fact, changed the hours where people have to pay for parking to try to make sure that people are able to be in downtown Charleston but still practice those things that will keep them safe.
That's right. So for example, when we ended our stay-at-home period and the businesses were opening back up, we used to charge for parking up until as late as 10 o'clock at night. We cut that back to 6 o'clock. We offered parking spaces for businesses, for restaurants to have free pickup and for customers that want to pick up. And we've relaxed our regulations about sidewalk dining and allowing outdoor spaces. So like right now, we're having to really be careful because restaurants and bars are the places where people gather, and just by the nature of the business, it's where they take their mask off to eat and drink. And so the virus has been spreading, and so we need to keep occupancy levels low to dine outside as possible, and just whenever you're not eating and drinking in that act, to please wear your mask. I can't say it enough.
You can't say it enough. We appreciate your time, Charleston Mayor John Tecklenburg, for spending some time with us this evening. And remember the 3 W's: wear your mask, wash your hands, and watch your distance. Mayor, thank you again.
Thank you, Carol.
And Mount Pleasant Shop is beating the odds by finding ways to build business during this pandemic. News 2's Kate Prestak spoke with one of the owners about this unlikely success.
On March 26th, co-owner Ebony Mullins landed here in Charleston from San Diego, and on March 27th, she opened their doors, and they've been declared an essential business ever since. Owning and operating a small business during the coronavirus pandemic has been said to be more than a difficult task.
I just opened the doors for 11 hours a day, and it was scary at first, you know, because we didn't know what was going on.
But opening a small business at the beginning of the pandemic and staying open is what some would say is a miracle.
It was the very beginning of what was happening, but then you started building a community. People were stopping in and just wanting to have a conversation.
Being in an alcohol and food beverage category, Mullins explained they were able to do a lot of takeout and to-go services. But for those that were able to come in, they were given an education to expand their palates.
We cater to the small wineries and vineyards across the world and bring them in that people just haven't had the experience. You know, there's more than 4 varietals in the world, right? And a lot of people have come in the very beginning, and I've seen them progress to different kinds of tastes.
Right now, the shop is closed for a redesign, this being to better their space and become more friendly to social distancing protocols. But Mullins says they should be back in no time.
It should be in the next 3 weeks. We are planning also doing a pop-up wine tastings and stuff so that people don't miss the fact that that's what we've been doing.
To find out when Leah's Old Village Wine Shop will have a pop-up during their closure or when food trucks will be in the area, you can find that on our website. That's counton2.com. In Mount Pleasant, I'm Kate Prestak, Count on 2.
We all know hospitals are working to find creative ways to get more people treated and tested during this pandemic. So MUSC looked at some unusual sources for inspiration. News 2's Antonio Stinson has more on the story.
MUSC has a drive-in COVID-19 testing site in the parking lot of the old Citadel Mall, and they say that the creation of the site was inspired by an unlikely pair. The MUSC drive-in COVID-19 testing site is the first of its kind on the East Coast, and the process is relatively simple.
You would go through our virtual urgent care where you get your initial screening. It's a series of questions, and if through that process it's determined that you have to get a specimen collected to see if you're COVID positive, we would actually funnel you through our drive-through.
The site now services around 500 patients a day, and Dr. Crawford says that the site can owe its efficiency to a popular fast food chain.
Chick-fil-A, I mean, they have the regular drive-through, just like any other drive-through. You're going to pull up, somebody through the speaker is going to ask you what you want, then you're going to go to one window, you're going to pay, then you're going to go to the next window, and you're going to get your food. But when you overwhelm that process, what's your default process? Well, guess what they do? They put somebody outside. So as soon as you go in, I already have the information of what you want. And you're not even going to make it to the window.
It was also inspired by one of America's most popular sports leagues.
If you see a NASCAR pit crew and how they're able to safely and efficiently get their car what it needs so they can travel up to 200 miles per hour, that absolutely is the inspiration. So if somebody's not feeling well, the last thing we want to do is to keep them in their car for hours and hours and hours.
They couldn't do it all by themselves, as MUSC partnered up with Clemson to extend their reach beyond the Lowcountry.
So if you think about what Clemson would help us do is to cover a broader area of the state as we do our specimen collections. They're just a wonderful partner and hopefully helping us flatten the curve.
Dr. Crawford told me that he hopes MUSC will be able to expand their sites to other parts of the Lowcountry and in South Carolina. Reporting from Goose Creek, Antonio Stinson, Count on 2.
Next on News 2.
From canceled practices to altered schedules, the world of sports looks different in this pandemic. We'll take a look into the changed world of sports when we come back.